Hi everybody, Dr. Paula Sauer here. I am answering a question that I got online. Actually, two questions. Same question, actually. I posted a video recently about knee pain, and the video really targeted the patellofemoral joint. So, of course, this isn't the only source of knee pain we can get. We can actually get knee pain in several areas, and what's popped up online is, hey, what about when the inside part of my knee hurts? So I'm going to talk about that a little bit today, what causes that, possible causes. I can't diagnose you, but I can give you kind of a laundry list of like, maybes, this might be what's going on. And then a self-release technique to help you for the inner part of your knee and help that area feel better with your movement. Here's my knee. Woohoo! This is the outer part of my knee, or what we call the lateral part of my knee. So when we talked about patellofemoral pain, usually the pain, you can get pain down here into the patella tendon or the quadricep tendon. It's got a couple names here. You can have pain and swelling under the kneecap, and sometimes it presents around the outside edge here. We usually call this like anterior knee pain, pain in the front of the knee. And when a patient describes this, we kind of first want to see what's happening in this area with the patellofemoral joint. The question online became, what about when pain surfaces on the inside or the medial aspect of your knee? Well, this can be a few different things. Number one, inside the joint here, if we've got some pain and tenderness along the joint line, it can indicate a meniscal tear, depending on what motions aggravate this. So if your foot is planted down on the ground and you twist your leg a little bit like that twisting motion, if that's an aggravating motion for you, then it can put a slight indication that maybe there's something happening inside the joint, meniscal wise. It's not the only thing that can happen. We have cartilage on the big part of the knuckle of the femur bone, and you can have some arthritic changes happening in the joint itself. You can also have some cartilage break off and get stuck in things, and that can cause some of this. And then we've got some superficial structures on the outside here. This is the pes anserine, where we have several muscles come together and insert down onto the tibia. And we can get some pain and irritation here. We also have a ligament right on the inside part of the knee called the medial collateral ligament, and sometimes that's where the pain is. And that can be because you have a strain that happened there, a sprain, excuse me, where there might be some micro tearing of the ligament there. So we've got a few different things that can be happening here. Generally, the pain is going to be on the inside of the knee, and sometimes it can be in the back part of the knee and just feel like it's deep within. You can get swelling all around the knee and not just local to the area. If it's just in the superficial area, chances are it might be a more superficial injury, but there's no way to really say, yes, that's what it is, unless you're seen by a doctor. So I just want to be really clear that if you haven't been seen by a doctor for your knee pain and it's interfering with how you function day to day, this is your little nudge to say, hey, go to the doctor, get it looked at, because sometimes that X-ray or MRI imaging is very telling of what's going on the inside. Similar to the other video I did where we're releasing structures on the outside of the knee, now we're going to focus our attention on the inside part of the knee. Here I'm going to do the demonstration with my pant leg rolled up, but then I'm going to pull down to go up a little further into the leg here. So along the joint line itself, if you take a ball, this is got a little give to it. You want something kind of rubbery or foam-like so it'll stick down onto the flesh. And then you're just going to go back and forth and then up and down in that area. And then move that ball into different areas. Here I like to use a ball because we're going right along the joint line and I want it to have some give to it in case this is really inflamed. If you're pressing down and you're going, that hurts a lot, please don't work through that pain. I'd rather you ice this and let that irritation come down before you're doing any kind of tissue release on yourself like this.
Or you'll go above it and work all the way up the inner thigh versus coming down to the joint line. So if this hurts, move past it and then keep working, okay? So you'll work all the way around that area. If it's like a feel good kind of pain, you're gonna go up. Notice I'm going up from the joint line now and I'm starting to move my way up my thigh. So if I take the pant leg down and give you a wider shot here, that's the joint line. Just making the 3-point contact there, and then I'm gonna go up and start to go back and forth. That inner thigh part's gonna be tender, but not tender where you're screaming. If you're screaming, then you're either applying too much pressure or that tissue underneath is too irritated and you shouldn't be working on it yet. Up and down, side to side, go again. And then you keep moving up the leg. How far up do you go? All the way up into the groin if you can. So you're gonna work your way up different spots. Can you go here and then here and here, like that 3-stripe concept on the outer part of the leg? Sure, you could definitely do that. Can I do that on my quad because I feel like there's tightness here? Absolutely. One ball is all you need and you just go back and forth. Super easy to do. Then once you do that, you're gonna wanna stretch the inner thigh, stretch your quad, and then see if that movement is still painful for you and see if you can go through that movement, say stepping up a stair without pain, and practice that a few times just to integrate a pain-free movement pattern with the movement that was hurting you before.
Okay, I hope you found this tutorial helpful. All you need is a little ball. You can pick these up online through Amazon, or you can go to a sporting good store if you're allowed to shop there again. It just depends on when you're watching this video. I have more coming your way. This is, again, answering one of the online requests that I got. And if you have any other questions for me, all you have to do is put it in the comment section below, and I'm happy to answer your questions through these videos. My name is Dr. Paula Sauer, and look for more videos from me coming up. If you have a request or you'd like to request a private one-on-one session with me, just send me an email, paula@alignptla.com. Thanks so much.